His heart rate is more than 100 per minute. At that stage, you see the color of the baby. The color is seen in the mouth of the baby and you see the baby is pink.
We see now the heart rate of the baby has gone up more than 100 per minute. The baby is breathing spontaneously. Now this is the time to wean off this baby from resuscitative efforts. The bag and mask ventilation, chest compression and medication, all the things have to stop, and this baby is to be given free flow oxygen. The bag and mask ventilation was giving 100% oxygen. A free flow oxygen is given by again the oxygen tube. Oxygen is flowing at the rate of 5 to 6 liters per minute by hand, making a cup around the baby's mouth and the nose. It will be reduced to gradually to 80% to 40% and then atmospheric air. Now this baby is breathing normally. The heart rate is more than 100 per minute. The baby is pink, but there is some respiratory distress. So this baby will be shifted to an ICU and this baby needs nasal prong oxygen administration. I am sure that after the task being accomplished with professionalism, this baby will be normal, will have a normal development later on, although this baby needs further management in the NICU.
Summary. Immediately after getting the baby in a pre-warm linen, assess the baby in few seconds. Check whether it is clear of meconium, breathing or crying, has good muscle tone, color is pink and gestation is term. If yes, provide routine care. If no, within 30 seconds you warm the baby, position the baby, clear airway, dry and stimulate and give oxygen. Then evaluate respiration, heart rate and color. If the baby is breathing, the heart rate is 100 per minute, the color is pink, provide supportive care. If apnea or heart rate is below 100 per minute, provide bag and mask ventilation or positive pressure ventilation. After ventilating, if the heart rate is 100 per minute, color is pink, provide ongoing care. After giving bag and mask ventilation for 30 seconds, if the heart rate is less than 60, then along with positive pressure ventilation, you need to start chest compression for the next 30 seconds and check the heart rate and do the evaluation. If the heart rate is still less than 60, then you start medication, first adrenaline, and then check the heart rate. If it is still less than 60, then you give saline as a plasma expander. Even after giving adrenaline and normal saline, and it is more than 5 minutes, if the heart rate is still less than 60, then you give soda bicarb. The important thing to remember is that the bag and mask ventilation, chest compression and medication should be given simultaneously.
As you see, successful resuscitation requires anticipation of perinatal asphyxia, availability of equipments, drugs and other supply before the birth of the baby, and presence of trained personnel at the time of delivery. All the steps of neonatal resuscitation are based on objective criteria and should be carried out according to evaluation, decision and action cycle, as you have seen in this demonstration.